Welcome to Insure Smart with Tapan Singhel. Today we are dealing with the issue of prevention and how health insurers can help you deal with it. In fact, many health insurers now provide benefits to policyholders to remain fit and healthy. Today we have with us Mr. Tapan Singhel, MD and CEO of Bajaj Allianz General Insurance, who will throw some light on how you can deal with it and benefit from being taking preventive measures. Welcome, Mr. Singhel. So these days there's a lot of emphasis on preventive care. So in India, what are insurers offering in terms of preventive care and the benefits related to them?
See, one is that if you take care of yourself, you are healthier, happier, and much better. And the second is from insurance company perspective, the claims should be lower, which would translate to premiums getting lower for the customer on a long period of time. Now, as I mentioned earlier, that the way the insurance industry operates is it collects money from many to pay to a few. If it pays more to a few, then the money collected becomes more. It pays less, the money collected gets a bit less. So why I wanted to clarify this was a lot of people confuse that with preventive healthcare, the insurance industry will be trying to save money. The answer is no, it translates to better premium, more affordable, more coverages, and that is what it is. Preventive healthcare is good for the customer, is good for the industry, and that is how we look at it. So as an industry, I think the industry is obsessed and focused upon trying to make it part of the larger ecosystem of providing insurance, well, to bring that awareness first, and secondly to ensure good habits from a customer perspective is what the obsession is. I remember early on the industry started by giving discounts at gym. It started looking at if you're going to gym regularly, you get discounts on the premium. Then you had this fitness bands which came in. Then products got innovated that if you're walking so many steps over time, you get discounts in your premium as you progress. Now, if you look at the products, it also has inbuilt, if you do regular checkups there, that get reimbursed. Now you have OPD covers coming in along with the free checkups, being part of it, or doctor consultation on telephone as built in the product itself, so that at a very early stage you're able to figure out if something is going wrong. It does not go to a longer phase of it. So the entire ecosystem now, which I look at, is getting created, where insurance is a part of it, but wellness, health activities, integrating it together and building it on is getting built up. So that is the progress I've seen, and it's a very good progress to
So, but in your personal experience, do you think these kind of measures have made people more conscious about their health and fitness?
We have not done a study that has it made or not made. But one thing I've definitely seen that people are aware about preventive checkups. Yeah. People are aware about taking care of themselves. It has become much more than what when I was younger. I think at that point of time, none of us were really worried about what we're eating on the street or what we are. But today, if I look at people, they're very aware. They can tell me exactly what food is good, what food is not good. I could not tell that. The awareness level has definitely...
In fact, the kids will beat the adults.
Yeah, they're much more aware than what we are. So to your point, Nidhi, I think that is built in. And the ecosystem creation actually gets people aware to be part of it. It will definitely have an impact. People are living longer now. If you look at the average life expectancy has moved up. People are taking much more care of themselves. And somewhere there has to be an ecosystem which provides them access to all that, they can do so. So good level of awareness, a good ecosystem creation is the right match. I think that is what it will be heading, and it will have an impact going forward. But if you ask me often, I can't give you data points of correlation.
In fact, we've seen that recently, the age limit for senior citizens has been increased by the regulator for buying health insurance. So how does preventive care work in these policies among senior citizens? Because they might have certain diseases already.
For senior citizens, there are 2-3 things that are more important, which I think is first is getting them to the hospital in any emergency. Earlier, India was still having a lot of joint families, and people were very close to each other, staying together. Now it has a lot of nuclear families. A lot of senior citizens are staying alone in towns in which they may not have any relatives also close by. So if something goes wrong, how do you get them to the hospital at a hyper speed, and how do you get them treated? Because we are all aware that the golden hour plays a big role,
Right.
in terms of the quality of your life. So as a company, we thought that how do we build that together? So we have created a chain of ambulance networks and emergency SOS buttons, or sudden fall detection on the wearable, and getting a call at the call center, calling them up, getting them picked up. So for us, the obsession was that as senior citizen, the bigger worry was things go wrong. How do you get them to the best hospital, best doctor, the best time? I think that was the first obsession. The bigger obsession then, no preventive health issue is loneliness after that. How do you solve loneliness? Because that itself is a big no cause of illness at a senior citizen level. And now we are talking to create that ecosystem of trying to see how do we solve the loneliness issue. Then comes your regular health checkup and all. At senior citizen, I've seen that they are mostly conscious about it.
Right.
They would do this. But the other two is what the gap is. So as I mentioned to you earlier, that we build an ecosystem of trying to see how do we solve issues. But right now, if you're able to do that for senior citizens, then I think it's a much better place to be.
Yeah, so switching to the younger generation, a lot of them feel that they don't need a policy at all. Do you think these benefits that you were mentioning earlier also, if they continue, if insurers continue to give them, will it kind of encourage them to take up this seriously?
Okay, so the only message I have for them is, let's say they don't want a policy for themselves, but would they want their money to be utilized for somebody else's benefit, recovery, or bringing them out of the issues that have come up, or helping them out? If that be the case, that's what insurance does. At times the money may not be utilized for you because you are doing very good, but your money is getting utilized for somebody who's facing a lot of difficulties, has faced difficulties, to really help them out. Your money is being used for a good cause. But let us say something goes wrong with you, then everybody else's money comes to your rescue and brings you out. So the way I look at insurance, and I'm actually over-insured at times, a lot of people ask me the question is, it's not about just me, it's about the society that I live in, and it contributes to that. If, God forbid, I require sometimes, then I get that benefit. So I have mental peace for myself. At the same time, if I'm doing very well and very healthy, and God willing, you should always be, is being utilized for somebody else who requires it.
Right. Thank you so much, Mr. Singhel, for this talk on preventive care, because it's something that is very, very important, and people should be very conscious about it. Health and fitness is something that people have become conscious about. So that's good news. Thank you so much.
Thank you, Nidhi.